you okay with me giving both copies of Steve's responses, your responses on Amanda and nothing?
They're at Starbucks.
Oh, okay, good.
I'm like, oh, did they
Yeah, that's fine.
drop
There's a
out?
big group of them over
Okay.
All right, awesome. You didn't say anything bad yesterday.
We got it. I got it.
Welcome to AT&T's teleconference service. Please enter your access code, followed by the pound sign.
Thank you.
How things going for on
Your access code was not recognized. Please re-enter your access code, followed by the pound sign.
Chad, did you guys talk about the side loading of the tobacco surcharge?
Yes, I had that conversation, and our recommendation is that the issuers submit the same data in the same format, once for tobacco, once for non-tobacco. So,
And so the with tobacco goes into the system.
with
the
tobacco,
non-tobacco goes out around the system.
correct.
So
Yeah,
it goes in the supplemental.
it goes in the supplemental. So the with tobacco goes into supplemental. The non-tobacco goes through normal serve process.
All
Yeah,
right, so you guys are good with it.
we're good with that.
We're good with it.
All right.
So
We'll let her finish
we
up.
talked to CMS about them validating in HIOS non-tobacco rates. I mean, it'd be valid for non-tobacco, it's not for tobacco products.
Well, since the, I don't think there were any issues for them to worry about.
The notifications are still in draft.
You guys?
Let me think about it. I don't think so.
We probably need to talk about that.
Yeah, you can mention to them, I don't think they'll have any issues from their side on the subsidies or
All right.
CSRs.
We on? Yeah, because
Started recording on the video.
okay.
So how do I get it to the
How you doing, buddy?
phone? I was trying to go off memory.
It makes sense that I sent you earlier.
There's nobody on the phone, right?
You know, I'm catching up on email. Oh, there it is, 8:11.
I have no idea how you, oh wait, how about this? I don't know.
Start when I go over there.
It might take hours, I don't think, technically.
We gotta hang up first.
They have to go through the exchange, certified copies, and then they can take that one outside.
Once they take it off,
But if they don't have any contact, then they can't be, I don't think it'd be recognized.
but here's the thing, so.
Welcome to AT&T's teleconference service. Please enter your access code.
Plan items are the same on the exchange and on the exchange, right? If they want,
To join the conference as the host, press star. Otherwise, please enter your host password, followed by the pound sign. There are 57 participants on the call, including you. You are joining your conference as the host. For a menu of available commands, press star pound.
Good morning. Thank you for everybody. Sorry we're a little bit late, but I think we got everybody on the call since it said that there are 57 people on the call, so plus people in the room. So thank you everybody for being here today, May 8th, Carrier Onboarding meeting. I think we have 3 left after this. We originally, the last one was supposed to be next week, and there were a couple of catch-up items that we had on there. We have since posted a 4th amended Carrier Onboarding schedule that includes, I think it's going to be May 22nd and May 29th with actually specific information on there. So as we talk with you guys, we realize that there's more to talk about and adjustments to the things that we have talked about, and so moving forward with that. I believe that we also sent an email out to the Carrier Notify listserv on Friday requesting information regarding retroactive terminations and partial payments. We would appreciate if you guys could provide us information from that email soon today or tomorrow would be great, so we can kind of finalize this. One other item, I don't know if you have seen the CMS Q&A that says that you can't use tobacco age rating for the first year. We have fixed that. So just before you start having a heart attack, we're gonna work around it. But the issue is, for those of you that are in depth in these Q&As, and this was like Q&A number 53 or 54 from the hundreds of Q&As that were released, so you may not have seen it yet, or you may have seen it and not realized that it's an issue yet. But in any event, what the Q&A says is, or let me back up on that, how the system works a little bit. So my understanding is you go to HIOS, you get a plan ID or carrier ID, whatever ID you get, then you go into SURF, you put all your templates into SURF, you put all your data into SURF. That information then goes to HIOS to be validated, and once it's validated, it turns on the spigot and says, okay, go to the DOI to be certified, go to the exchange, it's releasable or something to that effect. The problem is that the HIOS validation scripts were based off of the preliminary regulations that did not allow age rating for tobacco usage. So what the HIOS validation system is doing, and this is nationwide, the HIOS validation system is saying that the 63-year-old's premium cannot be more than 3 times the amount of the 21-year-old's premiums. I think those are the correct age bands. And so if you provide an age rating for tobacco usage that's anything other than a flat percent, it will be more than 3 to 1, and it kicks it out as invalid. The regulations were finalized to allow for age rating of tobacco usage, but the script was not designed that way because it was designed in preliminary regulations. And so the script is basically finalized for now, and CMS has indicated that they will not correct that script until sometime in 2014. So what we've decided that we're going to do to allow Nevada carriers to age rate tobacco usage, if you would like to, in accordance with the final regulations, you are going to submit the SURF data template for rates just like you would without tobacco surcharges on it. That piece will go into the system and be validated. Then you will provide the same SURF template with the tobacco surcharges, however you decide those tobacco surcharges should be, as long as they're not more than 50% for any individual on the exchange. You're going to supply those tobacco surcharges as in the same SURF data template as a supplemental attachment, or however you do supplemental documents in SURF?
Yeah, it's an addendum document or additional supporting documentation that is part of the binder, but not part of the formal filing. So it's where you're already adding other plan collateral items and other things that make up that binder that are not those data templates specifically.
But we need it in the SURF data template format so that everybody provides it the same method so that we can easily put it into our system. So the same Excel template format that SURF has provided, just put the tobacco surcharge pieces in the supplemental piece of that. So we will take that and load it into the system in a semi-automated methodology on our end.
Right.
Any questions on that? Or do you have something to add?
I was going to indicate in the SURF data file, there's actually an election when you provide the rate. This is in the rates template that says, is this a tobacco rate or is this a non-tobacco rate? So the filing that goes through that will be validated by HIOS should have that field set to non-tobacco rate for all plans in that, or all rates in that file. The one that's supplemental should have the flag appropriately set that this is a tobacco rate for that entire file. So the data should look the same. It's the same amount of data, same information. Just one file will have the flag set to yes, one file will have the flag set to no, and it's the no that gets filed as part of the official SURF binder.
Are there questions about that? And as you know, age rating of the tobacco surcharge is optional. That's up to the carriers. If you want to just provide a flat percentage, you can do that as well. But we want to make sure that you have the maximum flexibility to provide what you need to based on the final regulations, or whichever ones have been finalized so far.
Right. So a clarification, if you are doing a flat percentage across all age bands, you can still use the single file for both tobacco and non-tobacco. It's only if you're going to age-rated tobacco do you need to provide that supplemental file.
Any other questions? Well, any questions?
One quick question. Is that going to be documented and mailed out in a document or documented in the Q&A?
We'll put it in the Q&A.
Yeah.
Awesome. Thank you.
Yep. All right. Well, we're going to go ahead and then start with our kickoff. As usual, let's go ahead and do a roll call of who we have on the phone. So if one representative from each carrier on the call could please identify themselves so we can take roll.
Nevada Health Co-op.
Co-op?
Yep.
Welcome, Anthem.
Anthem?
Guardian.
Guardian?
Coventry Healthcare.
Coventry?
UHC Nevada.
United?
Premier Access.
Premier Access?
Liberty Dental.
Liberty?
Health Plan Services.
Health Plan Services? We have Hometown Health here in the room. Is there anybody else?
St. Mary's Health First. Excuse us.
St. Mary's Health Plans.
St. Mary's?
Yes.
What about Altius? Or is Altius there?
That's Coventry.
Oh, that's Coventry. I'm sorry. They identified themselves separately last time. So, all right. I think that's everybody.
All right. Thank you, John. So as John mentioned in part of the kickoff, this is the May 8th carrier onboarding session. Specifically, we're going to be looking at fulfillment, ID cards, plan collateral, and looking at the details around those. Quick introductions here. My name is Chad Hogan. I'm with the Senior Vice President of Choice and Xerox team working on the Nevada implementation. Along with me is Steve Huynh, our VP of Operations.
John Hager, Executive Director of the Exchange.
Damon Haycock, Finance and Research Officer for the Exchange.
Shane Gruga, Implementation Project Manager for Xerox.
And we have Eileen with, sorry, I forgot your last name.
Sorry, Reba?
Reba. I'm sorry, Eileen Reba with Xerox, and Glenn Shippey with the DOI is here as well.
All right. With that, we're going to jump into the presentation. Starting on page 5, we'll jump into the notifications and documents section. So as we have indicated in previous sessions, there are certain regulatory notifications that need to be provided as part of the issuers becoming a QHP. Now, the exchange has chosen to take the responsibility for some of those notifications that would traditionally be managed by the QHPs. Specifically, that's due to the nature of the implementation that Nevada is undertaking with membership management and billing and really kind of becoming the system of record. So it necessitates that the exchange manage portions of the notifications. So on slide 5, we're outlining the notifications that specifically the exchange will be sending to members in regards to their coverage. So as I mentioned previously, the exchange is doing billing for both individual and shop. So the exchange will be sending out all invoices for payment to either the groups on the shop side or the individual members. In addition, the exchange will also be sending out CHIP invoices and collecting premium for the CHIP program. Eligibility notifications, delinquency notifications, those will also be sent by the exchange. Confirmation notifications, the initial termination notifications, and the reason I want to call that out is we will send delinquency notices, we will send initial notification, hey, we've not received payment, your coverage will be terminated. However, on the official termination notification, that is one that has to still come from the QHP issuer advising the individual their coverage was terminated and the effective date of that termination of coverage. So the exchange will be sending notifications and messaging to the member about that, but the official piece does have to come from the carrier. In addition, the exchange will be handing appeals notifications, as well as a renewal and annual redetermination notifications. That at a high level, it kind of explains the messaging that the exchange will be sending out. Any questions in regards to the specific notices that the exchange will be sending out?
Can you clarify eligibility?
I have a question.
Go ahead. Go ahead on the phone.
Would Exchange be treating the initial termination notification as the last delinquency notification, or they both will be separate?
They will be separate notifications, and what we're going to be telling the individuals that we've transmitted your termination to the QHP issuer. You'll be receiving a termination notification indicating your last day of coverage, as well as your certificate of credible coverage through 2014. So because of the guaranteed issue, I believe the certificate of credible coverage becomes null and void. So after that initial year, I don't think it's required anymore, but we'll have to confirm that.
Well, but the credible coverage is a HIPAA rule, right? And I don't think that the HIPAA rules have been changed. So
That's correct.
I still think that legally it's required, even though there's no use for it anymore. Just like COBRA.
Yeah, there's a note in a proposed reg for removing the certificate of coverage. So, yeah.
All right.
It's
So
a small note.
Will you be posting samples of the notifications on the website so that we'll be able to access and review them?
they are currently in the process of being written. Once they are available, we will discuss them with the issuers if there's a specific one during the individual carrier meetings.
Yeah. Once they're in final draft, we should be able to share that with each issuer so that you can review them and pose any questions that you may have. That shouldn't be a problem at all.
Okay. Okay, thank you.
So can you clarify eligibility notifications?
Yeah, so part of the requirements for the exchange is to notify the individual of their eligibility determination. Now we'll do that.
Determination.
Yeah, we'll do that both electronically and via paper if that is their preferred communication method, or they come into the exchange via a paper method. But ultimately, we will have to notice them of their eligibility determination, either in regards to an appeal or their initial eligibility determination, or redetermination.
Sure.
Right, and we'll also send them initial notice that they've been enrolled. Same thing with like the termination notification. We're going to send them something that lets them know we've enrolled you. We've communicated that to the issuer. Issuer will send you a welcome package, including your ID cards and any correspondence that you have in your welcome kit. So we'll have that notification as well.
So will that enrollment notification be sent after payments received?
That would be correct. So initial payment must be received before coverage is initiated.
Okay, thanks.
All right, so moving on to the next slide, we have a very high-level overview of the process by which the exchange will manage member notifications. So there'll be a member-level event that triggers a notification. We have a doc management system that will be identifying the document needed for the event, the specific information necessary to generate that notification is gathered from the exchange business operating system. We will batch those communications and will be sent to a doc generator. Now that doc generator will handle both electronic and paper communications. The individual will receive, if their primary method of communication is electronic, they will only receive electronic notification. If their primary is paper, they will receive both electronic and paper notifications. With the exception of, and I'll caveat the electronic with the exception of any notifications that are statutorily required to be provided in paper format to the individual. The batch is processed. The document is printed, sealed, and shipped or mailed to the member or group as appropriate, and the member receives it, and that's the end of the notification flow. It's a pretty straightforward flow, but just want to see if there's any questions in regards to it.
This is Art from St. Mary's. So when a person goes online to check out what their economic eligibility is, do they get a response back immediately, or is that flow through this system and they get a piece of paper in the mail that tells them what their eligibility is?
That depends. So theoretically, if everything checks out, they would immediately be notified, you're eligible, enroll now. So I guess we need to break out the enrollment process into basically three parts. You got the eligibility for public assistance part, and that's whether you're Medicaid CHIP or APTC eligible. And then you've got your shop and compare piece, and then you've got your payment and actually enroll together. So during the eligibility portion, there are several times where the system will do a data call to the federal data hub and to the eligibility engine. And so when those happen, as long as the federal data hub is available, then everything is going to go forward okay, assuming that there isn't any inconsistency. So there's a couple things could happen. First of all, the federal data hub could be unavailable, and so we can't verify the system until that data hub is available, or we have some kind of a paper document to verify that. The other thing that could happen is you've submitted information that bounces back from the hub that basically say, no, that doesn't check out, in which case you'll have to provide a paper document to verify that. So as an example, you say your income is a certain amount, it's dropped from 2 years ago, and we say, well, you need to provide some proof of that. So we'll go through the process using the attested data. We will assign we will provide an APTC calculation based on the attested data so that the person can do the shop and compare. We will enroll, and assuming that you pay the right amount based on the attested data, we will enroll you. They actually have 90 days to provide us documentation that says otherwise. Now, if they fail to provide us documentation within that 90 days, then we will adjust the APTC amount in this example so that it matches what the data hub provided. And so whatever data element that might be, if it doesn't match for some reason, they will have 90 days, and required by regulation to give us 90 days to provide us with the corrected information. Meantime, the APTC, we send an 834 file to you guys because the person is paid based on the APTC, the calculated amount. You will get a premium from that individual based on the calculated amount, and CMS will get an 834 file that says this is the APTC that the person is receiving. CMS will reimburse the carrier based on that attested amount. When that would change, sometime within the 90 days, if it came back that their information was incorrect, if it changes, then we will change the APTC prospectively, and at that point the individual will have to pay the increased amount in this example. The APTC amount would go down prospectively. Assuming they continue to pay, you should still be made whole, and the carriers will get the money that they need. The issue, of course, is if they decide to terminate, and whether they do it simply by non-payment or actually proactively tell us that they won't be doing it. And as soon as we find out that information, we will get that to you through the 834 process. But the idea is the feds will reimburse the carrier based on the attested data until it's proven otherwise, or not proven otherwise. You will be made whole. You'll get the full premium, whether that's through the participants piece and the APTC piece or some adjustment there throughout that you will be made whole during that process. The one item that the federal data hub is supposed to respond to us, and so far everything we've seen is they're going to respond to us within seconds or less than a second, so that's good. We get immediate responses. The one element that is not seconds is Homeland Security. May take up to 72 hours to let you know whether somebody is here legally. So let's say I go and enroll in the plan. The exchange will accept my attestation that I am here legally, and for I would say for most of our participation, probably 99% of us, it will go forward and there won't be any problem. The federal data hub will eventually return a response that says you're here valid, your enrollment's valid, and you move forward. There may be individuals who are not here legally. Now keep in mind they've got that 90-day period they have the 90-day period to prove that they are here legally. So even though the data comes back and says they're not here legally, they can provide us with documentation, say from a a judge that says, they are here legally,
They're going through the process.
that they're going through the process, whatever the case might be. If they get us the documentation within 90 days, their enrollment continues. Obviously, if they're not here legally, they're not eligible for plans. So they are terminated. I think that's still a prospective termination. You still get the APTC from the feds. So, I hope that answers the question.
Yeah, so the response, they will get some type of response, whether it's an immediate response that tells them what they're eligible for, or they'll get a response that tells them there's an inconsistency that they have to resolve. There will be some type of immediate communication that will allow them to take further action, whether it takes them down a single path for enrollment or a dual path for verification of eligibility and enrollment.
It's just that.
Okay, yeah, thanks, that helps.
Okay, go that route.
John, I have a question on that. If they still have the 90 days to prove that they're really in the country legally, if they run up claims in the interim, because they're going to be accepted, right? They're going to have claims in the interim. We're going to still get stuck for that first 30 days, like we are because of the APTC. Yes.
Well, the initial enrollment, first 30 days would be covered because they would have to pay in order to be effectuated.
Mm-hmm.
Yeah, so you will be reimbursed for the premium because they would not have been effectuated unless they paid the premium.
Right.
But the concern that you have is the adverse selection.
Yep.
And it's federal regulation.
Okay.
Sorry.
No,
And just to clarify, it's not just the first 30 days. If they pay their premium, if they take the full 90 days and they pay their premium for those 90 days, claims have to be paid for the full 90 days.
So the comment was that they have the full 90 days to get this resolved. And so if they don't, then it's terminated at the 90-day period, at the end of the 90 days. That only works if they continue to pay their premiums.
Mm-hmm.
So if they don't pay their premiums, then you go into the non-payment piece of it.
And then retro back to the last month of full payment.
So if they, sorry, this is Art again from St. Mary's. So if they don't pay the premium after day 30 and we get a claim in, they're still within that 90-day window. They don't pay premium between days 30 and 90. We get a claim. Do we hold that claim?
I think that they're in their termination for non-payment period.
I think if you're saying if they paid the first month, and then they don't pay the second month, so they start their 90 days for non-payment, but they're within their initial, they only have 60 days left to prove that they're here, they will be terminated for not being here prior to you terminating them for non-payment. Because the time frame will happen first.
So they would be terminated for, they'd be determined ineligible.
So that second 30 days, you're still on the hook for claims.
Well, no, because you can pen claims for the second month.
Well, all right. So let's
of the initial 90 days.
So somebody enrolls in December,
right,
and they pay for January. All right, and we determine them APTC eligible because what they attested. Their February bill is due January 25th. Their invoice January 10th. It's due January 25th. They haven't paid February yet. Now they start their 90-day non-payment clock. So the inconsistency period for their, they're not here legally, let's say, ends at the end of March. So then let's say then they haven't paid for February or March. Finally, at the end of March, we say you haven't resolved this inconsistency. They're terminated due to the inconsistency. The problem is...
They still have to pay claims for February.
I think that they are determined APTC eligible. And so so I think that you need to do the 90-day period for APTC. You pay claims for that first 30 days, which is the month of February, and then you start pending them after that.
Right.
The issue, of course, though, is when they are terminated for the inconsistency, they're not being terminated for non-payment. So how far back do you go?
You don't. It's at the end of March is when you term.
Yeah, you said it's prospective.
That's right. So it's
Prospective,
prospective. So you terminate them right then.
You terminate, it's over. They're on the hook. They're on the hook for the claim for February.
So it was prospective termination. So you terminated at the end of March. They haven't paid for March. So I think actually, in that, and you've pinned in March. So I think in that case, would it be a retroactive termination to the end of February?
No, because they didn't go the full 90 days of their APTC grace period. They only went 60 days because you're having two issues happening simultaneously, and they didn't make the 90 days of APTC, so you can't retro terminate.
Correct.
Right,
But
but you also
if
get
they
baby.
paid all the time, say they paid January, February, and March, and we found out that, they weren't eligible, we really have to pay the claims through March.
Yes.
Mm-hmm.
Yeah.
So the real loophole there is if they continue to pay their premium, we have to pay the claims.
Correct. Yes, we were very irritated about that when we saw that.
Okay.
And we still think that there are ways to fight it, but they're act of Congress type ways to fight it. So
it's
we'll
not
work
an
through that.
exchange business rule.
Yeah. So yeah, there's only so much that we can do at any time. We need to look at how those two combine and just make sure that we got that scenario down. I mean, I think you're right, Damon, but I think we need to make sure that scenario is nailed down, because that's going to be a pretty common scenario.
Well, adverse selection scenario.
I hopefully it's not that common, but of the weird scenarios, it will be one of the more common weird scenarios.
Right, so we're undergoing a process of walking through all the combinations of scenarios that we can think of and outlining those processes and make sure we have a business process that can handle each one of those.
Okay.
All right. I know we kind of veered into eligibility there and a couple other topics, but just coming back to any of the notifications that the exchange is going to be sending, again, looking at slide 5, any other questions specifically on those topics? All right.
This is Patty at Anthem.
Go ahead.
Do you have a timeline for when, delinquency notices will be?
Yes, the timelines around invoicing and delinquency notices was provided, I believe, in the individual and shop payment and reconciliation meetings, which were held, let me bring up the date. So it would have been the April 3rd and April 10th,
and last week,
as well as last week's session. So we provided an updated flow in last week's presentation to look at the timing around those.
Okay, thanks.
Okay. We're going to go ahead and move on to slide 7, and this is the one where I probably expect we'll get some more questions. This is the carrier notifications and documentation item, and these bullets are outlining the items that the issuers, carriers are responsible for providing and or sending to the members. A lot of them are going to be your traditional plan collateral. The first items there being your ID cards, your welcome packets, the traditional communication that you send out in the marketplace today. Consumer contact information collateral. A new one here is the segregation of abortion funds notification, where the EHBs, only the EHBs can be covered by APTC. So if the plan covers those type of services, that there's an additional cost which is not covered by the APTC tax credit. In addition, as you provide today, summary benefit as coverage, your EOCs. We touched on the termination notices with effective dates a little bit earlier, but again, that's one of the key things that the issuers are responsible for. If the QHP is decertified or non-recertified, there would be notices that need to be provided to the members that their plan was not, that the QHP was decertified or that their plans were not recertified. Certificates of credible coverage, we talked a little bit about that. There's pending regs that may change that, but at least through the end of the 2014 plan year, those are going to need to be provided as well. A couple of regulatory items, 156.220, the notification of plan modifications, cost share information, and everyone's favorite, the hard copy of the provider directory upon request. So those are some of the regulatory disclosures. In addition, all of the HIPAA disclosures that are required still apply. Those haven't changed, as well as fraud notices per 147.106.
So on termination notices, federal COBRA still applies, so we still need to make sure that those notices are provided. On the evidences of coverage, we did provide sample language for eligibility for evidences of coverage. And looking at that, and it's on our Carrier Onboarding webpage. Although once we considered it, you guys will be providing qualified health plans that will be provided both on and off the exchange, and so the rules that are off the exchange don't necessarily apply. They're different rules. You guys have your own eligibility rules, and I think for the most part they're pretty standard. But they're not necessarily going to apply. Certainly the rules that are on the exchange with the APTC doesn't apply off the exchange. From my understanding, the way Choice does it today, then this might make sense, is you guys provide your plan documents, your evidence of coverage, with a disclaimer in there, basically, that says something to the effect of, for those individuals enrolled on the exchange or employees enrolled on the exchange, see the attached rider, and we'll basically have an eligibility rider, if you will, that will discuss the eligibility rules on the exchange. So we're going to go back through the sample language that we provided and provide a more robust document that will be standard across for everybody. We do not expect you to submit that with your documents by June 7th, but the language saying in your evidence of coverage saying that see the exchange rider will need to be in your evidence of coverage with all the other documents. So just so you're aware of that, and we'll be working through that. We'll get that done as quickly as possible. But basically, the eligibility information in there will be all the stuff that we've been talking about over the last 3 months.
Yeah. So, I mean, part of the thought process on this is to reduce the burden on the issuers to have separate EOCs for both on and off exchanges. You file one EOC, and then you have the rider or addendum to it, which covers the rules for the exchange.
Any concerns or comments about that?
How many of these documents are intended to be included in the welcome package, and which ones are separate?
I don't know that the exchange has specific guidance regarding what has to go out in the welcome packet per se. I would say you would follow your normal collateral delivery process. If you include your EOCs as part of your welcome kit, then you would continue to do so. If you do them as separate collateral deliveries, you would continue to do so. You still have to meet the statutory and regulatory requirements of providing the documentation. How and when you message that to the member should follow your processes you have today.
So there was a question about, is it required to send out the EOC? And it's required to send it out upon request. But we will have links on our website to your EOCs. When somebody enrolls in a plan, they will be able to pull it up at any time. We hope that they will pull it up that way, rather than call us or you for the information.
Right.
We do not intend to provide the evidences of coverage. That's something that in hard copy, that's something that you guys would do, but it would only be upon request. So it's not required to send it out unless they request it. And I think in regulation it says upon request.
Yes.
But yeah, so this information is basically whenever you send it out now. Now, if you send out the evidence of coverage, you would need to include our supplemental document that talks about eligibility, because it goes with it, right? But otherwise, I think all of these would be based on whatever processes you have in place now.
Is a physical ID card required, or can it be electronic and upon request provide a physical ID card?
If your processes allow you to send it electronically, then I don't have a problem with that. I don't think we have a problem with that. And I haven't seen any regulation that says otherwise.
Okay, thanks.
Is the rider optional?
Well, so this isn't, maybe rider's the wrong term. Maybe it's a supplemental.
It's an addendum.
It's not optional because it's the eligibility rules for the exchange. I mean, as we've been talking here, the APTC eligibility rules are different from anything that you have ever dealt with, right? And so we need to be very specific on that and make sure that everybody is clear on what the rules are for eligibility, appeals, etc. So again, the information that's on the website, we need to tweak it. More than tweak it. There's a lot of stuff that we got to fix on it. when you start a document and it goes through a 2-month process to review and correct it and everything, the requirements from when we started are not the same requirements that we have now, and so we'll work through that. But obviously, we've talked about them here quite a number of times, and most of the requirements that we've discussed are in the Q&A if you've missed any of these conversations.
Gotcha. Now, on slide 7, the explanation on coverage, that's the evidence of coverage you're referring to, right?
Yeah. Yes. Yeah,
Okay.
it's an evidence of coverage.
We'll correct that on the slide.
Gotcha. Okay, thank you. Then the summary of benefit of coverage, that's the federally mandated SBC that we've come to know about, right?
That is correct. Yes.
Okay. Thank you. I appreciate it.
And again, both of those documents will be available electronically on our website. Do we link directly to their site?
Yes.
Or do they provide us a PDF that we...
So the issuer is required to maintain, update, and manage those documents on their site, and we will link to them. You can provide links. The links are gathered as part of the SURF data templates for links to your SBCs and EOCs, and so we will be using those links that are provided to direct the consumer to the appropriate part. Now, as we had previously indicated, and I believe it goes all the way back to our rates, plans, and benefits, which is, I think, our 3rd onboarding session, we had indicated that you can provide a static link, or you can provide a link that will accept parameters so that we can pass in things like plan IDs or effective dates as appropriate to populate those documents so that when they're generated on your side, that you're not sitting there constantly maintaining documents for every effective date and every changeover, but you can manage it dynamically. So that's part of the conversation we'll have with each issuer during the individual onboarding, is how you're going to manage those links and what the methodology and rules around generating of those documents from those links will be.
Any more questions about this page?
Can you explain what the notification of plan modification is?
So that the notification of plan modification, it's a regulatory requirement, and so if you submit any type of plan modifications, you have to follow those regulations. So there's specific requirements of submission for those plan modifications. So any QHP that's available in the exchange that gets modified needs to follow those rules.
So this Title 45 CFR 156-220.
It's transparency and coverage.
Yeah.
Does that answer the question?
Yes, thank you.
All right, any other questions on slide 7 before we move forward and just look at the flow for the issuer notifications? All right, so moving on to the carrier to member notification cycle overview. We are, for the most part, your communications will all be triggered by some type of enrollment activity or payment notification coming to you via either an 834 or an 820. From there, you're going to ingest that into your system. You're going to run your specific notifications against those activities that have occurred as a result of the 834 and 820 transactions. The expectation is you would follow your same processes and procedures regarding when you send those documentations, the timing that you use, whether you batch or not. The exchange isn't dictating any specific processes around those, and then you would communicate that information to the member as you would in your existing business process flows. Any questions about that flow? Okay.
So we're going to take another look at the plan modification item, and we'll get back to you. That reference is not correct, so we'll figure that one out for you.
Okay. So moving on to slide 9, some regulatory requirements. So as part of the notices, These are the requirements that kind of fit around those notices specifically. So as defined, there needs to be provided a citation to or identification to the specific regulation supporting the action, including the reason for the intended action. So if, when we're sending out notifications regarding termination, whether it's retrospective, prospective, whether it's a late pay, the 90-day grace period, we will be citing the regulatory statutes where that comes from. And the requirement is also there for the issuers that any communication that comes out, you would provide those same CFR references in regards to what action was taken and why. I think that's pretty standard, but I'm going to ask if there's any questions in regards to that. Okay. The notices do need to be 508 ADA compliant. So it's not just limited to font and font size, but also that they are in an accessible manner. A lot of this is going to apply to any communication provided electronically, not so much print. So that they're screen reader capable, that they can be displayed in for individuals with low sight, those kind of things for electronic notifications. The notices that are sent from the exchange and from the issuers, notices will be provided to enrollees in plain language, and the exchange has adopted a standard of at an 8th grade reading level. We did have a question come in regards to the EOCs and some of the other more legal language. There is a Nevada statute requirement for a Flish-Kincaid reading level, I believe, of 40. That would still apply for your legal EOCs and other documents that are not specifically notifications to a member.
Which is more like a 10th grade reading level.
It's more of like a 10th grade or a little higher reading level.
Thank you.
You didn't want to put your EOC in an 8th grade reading level? What is that?
Not at this time, anyway.
You can't figure out how to do that? What's wrong? Come on, you guys are smart.
I got a couple of kids I can help out with. My kids can help out with that probably.
Lots of pictures.
Thanks.
Yeah, no, we get that. There are certain things in here that are just complicated topics that, an 8th grader is just not going to understand. And so where you can, we think the notices can be done at an 8th grade reading level. There's no reason that they can't be, we think. If you come across a reason where there's a problem, let us know and let's look at it together. But I think that notices can be done at an 8th grade reading level. But we recognize the evidences of coverage are a little more complicated.
I appreciate it. Thank you.
Language assistance programs. I think this is a fairly common item today where you provide language assistance, communications in multiple languages. Those don't change. The same would be there, the same as exists today. In addition, there's a record retention policy, 10 years for communication and of communication sent to members. So that is the record retention policy. Any questions in regards to kind of some high-level bullets? I mean, we're not going into the details of the weeds here. Most of these you have today requirements around it, but again, we're just calling them to the surface to make sure that we're all on the same page. All right. So if there's no questions on slide 9, wanted to bring up a topic on slide 10 that is a little bit ties into the eligibility piece, but it's one of those items that we wanted to bring up as kind of an adjunct since we're talking about communication and document flows. And one of them is misdirected communication. This is in the event where we have an eligibility determination go out, there's an inconsistency, and the member submits the documentation directly to a carrier. We don't think that's going to happen often, but they might just pull out their ID card if they currently have coverage and send it to that carrier or something like that. So we are determining a rerouting process so that those documents can be submitted to the exchange. And we're going to, because of the unique nature of it and the fact that we believe it'll be a low occurrence, we're going to work with each of the issuers, much like we do on the payment remittance side, to put together a process that works within your workflows that fits into what the exchange needs, so that we can facilitate communication, documentation, payments, anything that goes to the issuer that should have come to the exchange. And we'll try to integrate some of those so that we can have a fairly common process around that, but something that we wanted to call out as an additional item that we're seeing the issuers may get, and we want to work to make sure we establish that process appropriately with you. Any questions about misdirected documentation? All right.
Applause?
Yeah. It's a squirrel trying to get his acorn.
All right, so we're going to move on to the ID card discussion. And John, I'm going to let you kind of talk through this a little bit. Yes.
Moving the bullseye.
Yeah.
Okay, so looking at this, we discussed about whether or not to have we'll start with the ID number. We discussed about whether or not to have the ID number required, and there was a lot of concern about providers issuing claims under the wrong ID and that creating some havoc on your end. So the Nevada HealthLink ID number is optional. That's up to you. If you guys figure out a way to do it and you want to make it work, then great. On the phone number, and we realize it says optional here. We had discussions about this today, though, and we do think that it would be appropriate to have the Nevada HealthLink phone number on there. You guys are not doing billing. You don't want somebody calling you about billing. You want them calling the exchange. So what we think it should say is something to the effect of for enrollment and billing, please call Nevada HealthLink at, and we don't have a phone number yet, but we will soon. So we need to change that piece to mandatory. We've got the logo on there as required. We recognize that there's a lot of cost adding multicolor. We would love to have our logo in the 4 beautiful colors that we have chosen. However, we also understand that adds cost. So it will be either in the colors that we have or monochrome. Or white. It's basically if you have a white card, there's a gray scale monochrome color. If it's a black card, you have a white logo basically. So that is the logo stuff. We have the logo guidance guide. It's a whole book of there's 20 pages of what you can, how you can and can't use the logo. You can't cut it. You have to have a certain amount of space around it. They're not difficult requirements. The minimum size is a 1/4 inch, and we looked on all of the ID cards that we had, and all of the logos of the primary issuer were almost a 1/2 inch tall. Our requirement is it can't be less than a 1/4 inch tall, so I think that it should be able to fit in with the logos that you have on there. I realize the cards are crowded, so but in any event, so that's the logo piece. Are there any?
We're going to post the branding documentation on our Carrier Onboarding site later today. So you'll see another section that talks about the logo and right there on that Carrier Onboarding page to help reference on what you can and can't do and what are the different monochrome and options and those things.
So the document says how you can use it. Colors, crop, no cropping allowed, you can't rotate it, etc. But it doesn't say when you can use it. We expect that you may want to advertise, Carrier, Acme Carrier now available on Nevada HealthLink. Something like that would probably be you'd be allowed to put our logo on there. We have not yet figured out what the restrictions are on our logo. So we would expect you to use it when you feel it's appropriate. We want to be careful, of course, associating our brand with things that we should not be associated with. I'm just going to leave it at that. But so we're going to try and come up with some standards for that in the next couple of weeks. But generally, we think that carriers will be able to use it nearly at will. But we want you to get we would be happy for you to get our brand out there. And I think that we can work on this together and get your names available on Nevada HealthLink. So So we'll work through that, but you should see some kind of guidance on when it can be used, in addition to this document that says how it can be used.
Okay, and so when you that document of the when and the how and such, will it also have the actual logo?
You mean the actual file itself? It will not be part of that. We will be able to provide each carrier with a multitude of types during their one-on-one onboarding process.
Yeah, as part of we did receive questions regarding what size will it be, what format will it be, will we have multiple formats, color, non? The answer is yes. Yes, you will have multiple formats, you'll have multiple type sizes, multiple options to use it, all that fit within the brand specification guidance as part of the carrier operations track. So if you're looking for where is this going to fit as part of your technical discussions, it'll be part of your carrier operations track that would be responsible for handling that portion in the one-on-one integration.
So,
okay, well,
yeah,
awesome.
And the sizes are go ahead.
So is that something, I know we've got those operation meetings, but is this something that we're going to be able to get soon? Because if we have hopes of changing our card, this is really something that we need within the next week or so.
Yeah, we can provide it very quickly. So as part of our next one-on-one meeting with each of the specific carriers that's scheduled, I believe we have them scheduled with the majority of the carriers this week and next week. In your next upcoming one, let us know what your logo specification, what the file formats you need, and we will get you the appropriately sized logos in that file format. I mean, it's going to be your standard EPS, AI, high-res type imagery.
Awesome, thank you.
Yeah, I have a quick question about the contact information on the card. Am I correct in assuming that there's not a problem putting it on the back of the card?
That's fine.
Yeah, when it comes to the use of the logo, we are asking that you would provide a sample as part of that carrier onboarding operations track, just so that we can review and look at the placement and just do validation that it meets the brand standards.
And that the sample doesn't necessarily mean a physical hard copy mailed to the exchange. You can do a scan and electronically send it over.
PDF it or something.
Yeah, we're not asking you to just go through the process of creating one and then sending it over.
Photoshop mock-up.
Right.
Thank you.
If you look at the branding guide, it's pretty specific, and most of your questions will be answered. But there shouldn't be any other writing over top of it. It just needs to conform to the. It'll make sense.
Question. Can Carrier put their own logo on the card as well?
Oh yeah, absolutely.
I hope so.
I mean, you can if you got seven different logos on there. You can. I mean,
provider logos are often on carrier cards as well.
Or network logos, whatever. Our logo at the Public Employee Benefits, our card at the Public Employee Benefits Program has, I think, 7 logos on it. So we're just asking you to provide it. We're not saying that it has to be the only one.
Okay. All right. So we've reached the end of the formal deck in regards to the details of the specifically plan collateral, IDs, fulfillment section. So wanted to open it up for general questions in regards to that topic, and then if there are other follow-up questions from past carrier onboarding sessions, we'll be happy to go ahead and entertain those questions at this time. But I want to go through a couple of items that came in from some of the issuers. I think we hit most of them, but wanted to just go through here and make sure we covered them all. There was a question in regards to will a member's communication preference, meaning they're asking whether they want paper communication or they want electronic communication, will that be passed to the issuer and how? Right now, we are looking at if there's a way we can do it in the 834. The FFM, as we're finding, is when they've deviated, we're finding more and more gaps of things that we need to provide. So this is one of those items, and we're looking at a way that we can communicate that to you from a communication preference standpoint, because obviously if the consumer has elected electronic communication, we want to make sure that they get that preference and that you get to enjoy the cost savings associated with electronic communication over printed material if possible. So that's something that we will be providing further information on that. As an adjunct to that, the federally facilitated marketplace in their 834 has determined a method by which to transmit group information to the issuers, which is one of those kind of open outstanding items. So we will be able to transmit group information on the inbound 834 to the issuers now using the HIPAA standard promulgated by the FFM. So that was one of those big open questions that I'm glad we can close out, that it will be available in that 834. So we're not anticipating a separate service needed for that at this point in time.
Do you mean the separate group enrollment file which Federal was originally going to send across before the 834? Then Nevada will not be sending that?
That's correct. It'll be part of the 834, and the FFM has figured out how to put it into the 834 as well. So group information, tax ID, producer ID, and group address, I believe, are the 5 elements that they are going to pass through that standard.
And contact information.
And contact information.
Broker information.
Correct.
Broker information as well?
Yes.
So what broker information?
It's going to be the broker's name and producer ID, which for Nevada will be their NPN.
Yeah.
We'll be using their national producer number.
Okay, thanks.
All right. There was a question from a notification standpoint. Will the exchange be providing notifications for aging out individuals? So those are individuals who are currently covered under the family provision up to age 26, or those that are turning 65 and aging into Medicare. The answer is yes. The exchange will be providing appropriately timed notices to those individuals. I think we addressed this earlier, but there was another question that came in regards to can the issuer provide EOCs and other documentations available via a link on the web? The answer is yes, you can. Obviously, you're doing it today, so that doesn't change, but you do have to be able to provide a hard copy to the member upon request. And I think that covers the majority of the questions we had received.
I have one question.
Go ahead.
Do you have the draft of the Nevada application?
No. So here's the problem. We created an application based on all of the elements in the single streamlined application that the feds had issued, I don't know, January, February, whatever that was, that 16 to 23 page behemoth. And we were working through it, and then last week they said, oh, here's an application that's only 3 pages. Now, it's no longer a single application, so I find that interesting. It's 4 different applications. We need to work with welfare, who does the Medicaid eligibility, to determine how we're going to make that work. It needs some work. So we will eventually provide that. It's just it's not going to be available for, I would say, at least a month. It may be longer. It will probably be longer. It's complicated.
Right, and we should expect.
What's that?
By mid-June, we should expect the draft then?
We will get back to you in mid-June if we don't have a draft.
Okay.
Don't cross your fingers on that one, or you could, but I don't know if it's going to help. There are some major decisions that have to be made on that one. Obviously, we could go forward with the current application, and then our friends to the south and to the east will say, well, why do we have, or we got a 3-page application, so Nevadans will say, well, they got a 3-page application, why can't we have a 3-page application? So we need to take another look at it and see how we're going to make this work. But if we do 3 pages, it's not going to be a single application anymore. It's going to be multiple applications. So I don't know how they got away with it, but hey, they're the feds. They can do what they want, right?
So just a follow-up question on that. Is there a particular concern or something that you were looking for in regards to that question?
So I guess we could pose that to all the carriers. Is there a particular concern about the application for Medicaid CHIP APTC that you're concerned about? But if you have a concern, you can email us.
Okay. All right. Well, we actually had just a handful of questions submitted, and we covered most of them in the topics. So we've got some time left in our scheduled meeting. So if there are any other topics that the carriers on the call would like to discuss, or here in the room would like to ask questions, we'd be happy to entertain them.
This is Patty from Anthem. I have a follow-up question on delinquency notices. I went back through my notes and saw that at one time you had mentioned that the carrier and the exchange would both send delinquency notices. Do you have any concerns if a carrier should choose to send a delinquency notice stating contact the exchange?
Okay, so I think what we said was the exchange will send out delinquency notices, and did we say that they had to suppress them, or it was up to them if they wanted to send additional notices?
We left that open. The concern that we have is that if the notification is written in any way that would conflict with the communication that we're sending out. So as long as we can coordinate that effort and make sure that there's no conflict, I think we should be okay.
Yeah. The other concern there is if the issuer is sending delinquency notices, that it's inviting an opportunity for the consumer to call the issuer to make a payment.
No, we would not be doing that. We would be referring them to you to make the payment.
No, but I'm the consumer. I get a letter from Acme Carrier.
Oh, that the consumer could read that into it.
Yes. Yeah. So,
okay.
If your experience tells you that that's going to help keep membership up and consistency in it, let's coordinate on that messaging. Let's talk about that as part of the operations track in the individual sessions.
Now, one thing that you should note that the dashboard for the brokers, navigators, they will have the ability to tell whether their clients are behind. So my understanding is the brokers currently typically have that ability to look at that, and they, hey Joe, what the heck are you doing? You're behind on your payment. Oh yeah, I forgot. Let me get that right out. So so we will have that availability as well. So hopefully that mitigates some of the problems.
Okay, thank you.
Any other questions?
Has a determination been made yet about how the brokers are going to get paid in the exchange, especially in the shop? For say they have a group of 30 and each carrier gets 5, are we going to have to pay them on the 30 as total from each carrier?
How you reimburse the broker is up to you.
Okay.
So that was our determination.
Okay.
So it's in accordance with whatever contract you have with the broker or will have. We're not setting any rules on that.
Okay.
If you don't want to use brokers, that's up to you. If you want to pay them less, then that's up to you. If you want to pay them more, that's up to you.
We'll just identify them on the transmission over to you that says this was the broker attached to this account.
Now, I understand the concern is that typically for larger groups you reimburse at a lower rate because they had more volume. They don't need as much. It was easier for them, I guess. Mm-hmm. And I don't know how you're going to deal with that. Mm-hmm. That's up to you guys to figure out. And I think at least initially there's going to be kind of a wait and see and figure out what is going on out there kind of period. However you want to do your business.
Yeah, it's just, it's hard for us to make a determination when every carrier is getting a piece. It's hard, it seems to me that the brokers will be making more in commission than they were before. Because we won't know whether there's 30 people in that group or there's really only 5 that we got, or
potentially. Now on the 834 file that sends over group information, what group information does it send over?
It sends over the group name, the group address, the group contact, the broker, and the broker's number.
Okay, so it didn't have any amount of it. So now if you talk to the brokers, they say, well, it might be a little more than we're making now, but a lot less than we're making before the MLR cap. So again, that's a business decision you guys are going to have to figure out.
yeah.
Okay.
Is group size?
I have a question. How will we know, like, what metal level a group selected? Or are we just going to find out what plans the members selected on the 834?
You'll just find out what plans they selected on the 834 on an individual or employee basis.
Won't that plan ID number go over?
Yeah, the plan ID.
Yeah.
And that plan ID will be tied to the metal level of the plan.
Correct. Right, but
back into it.
But what she was asking is, if an employer selects the silver tier,
Right.
how will they know that? And the answer is they won't. An employer could select the silver tier, and you would see that all the things that came back would be silver plans. But an employer could select open shop, perhaps, or one of these package options. And if everybody in that, every employee selected silver plan, you wouldn't be able to tell whether the employer selected the silver tier or a package or open shop. So,
Yeah, we're not transmitting the purchasing model.
What about other information that we need for group setup, like the number of employees within that group's, total number, so that we can make sure we have, Medicare secondary pay set up correctly. We know if the group has COBRA or state continuation, things of that nature.
Well, you'll know Medicare secondary payer by the premium we transmit to you.
what?
Because you'll have a different premium for Medicare payer, primary or secondary, coming from the group.
Wait. Say that. The premiums are the premiums. What?
So the premium for the 65-year-old changes whether Medicare is primary payer or secondary payer.
No, I mean if it's 20 or more, the insurance carrier is primary over Medicare, whether the member's 65 or not.
Correct.
Right.
So how would we know that if you're only going to send group data via the 834?
So if you have other information, other pieces of information like that, we'll take that back to our EDI guys and make sure and see if they can get that added, or if we need to revisit that.
Yeah, we may have to do an append in the group name, or we may have to get creative to get some of that data to you.
So there's absolutely no way of swaying to change the mind for the XML file, which is consistent with what all the other exchanges are doing.
Wait, what are all the other exchanges doing?
All the other exchanges so far are going to commit to sending a group XML file.
I mean, we'll look at it.
Yeah. I think the feds are trying to get away from that, so they're finding ways to put the data that the issuers need into the 834s. But we will look at that, and we have been looking at what that XML option would look like.
Thank you for that consideration.
Wouldn't it be better for everybody, though, on a national basis if it were all done through the 834 file process?
Again, this is, for my opinion, no, because, we still want to get a group setup done because we want to know, for all kinds of things, MSP, MLR, we want to know who our contacts are. We want to be able to differentiate that that's a group versus an individual policy. So we're still looking to get that separate file to set up that group and then add the members to that group.
All right, we'll look at it.
Thank you.
All right. Any other questions before we kind of recap and where we're headed next?
Was there a question here?
I have a question.
Oh, go ahead.
In regards to the logo on the ID card, are there any requirements as to location?
No.
There's a preference. There are suggested preferences for where we would like it. It'll all be in the branding guide that should be on the website later today.
But there's no requirement for location.
Except it can't be behind other text or some of those types of things.
Yeah, you can't crop it, you can't rotate it, you can't put it behind text, that kind of stuff. So, a question in the room?
Does it? I'm sorry. Does the logo need to be on the front and the back of the card, or just the front?
Just one side.
Thank you.
Right now on our CMS file, we have to report what size the group is, whether it's Medicare, primary or secondary. Is that going to be an issue for us now?
We will provide you a report that
Okay.
will contain the information that we have that you need in order to do that reporting.
Okay.
So actually, we have a sample of it that we'll provide during the individual onboarding sessions.
Okay.
Yeah.
Thank you.
All right. So as John mentioned in the introduction, we have just a couple more sessions left. The fourth amended Carrier Onboarding schedule was published just recently, coming up on May the 15th, and I believe the deck for this was published earlier. It's going to be covering the public education, specifically looking at branding, marketing outreach, and advertising, and it is up on the Exchange site for you to review and submit your questions as usual on. On May 22nd, we will be having a customer service focused discussion looking at the customer contact center, the interactions with the contact center, brokers, and enrollment facilitators as they're part of that customer interaction. And right now we have an open session for May 29th to cover any other questions that you have that we have not identified specifically as part of one of the topics, and wrap up any other outstanding items that we have.
So the document for next week says Nevada Presentation Media. It says May 8th. That should be May 15th, so we will fix that. But it's the very top item on the presentation list.
Oh, and one other item that we wanted to call out. Should have brought this up earlier as part of the discussion we had in regards to the tobacco smoking, but previously Nevada had posted a copy of the SURF templates in a zip file for all of the issuers. At the time, we believe those were quote-unquote final files. However, they have been adapting and updating. And so rather than repost new zip files, we are changing the link to the actual SURF Carrier Onboarding Files folder, which is being maintained by SURF, and it updates every time they post a new version of a file with change control and logs and versions and all those wonderful things. So we'll be updating that link for the carriers to be able to grab the most latest, greatest version of the file. In addition, there was a FAQ document that was published by the NAIC in regards to filling out those templates, specifically in regards to common errors that issuers were getting in filling out those templates, and we are publishing that document out on the Nevada Carrier Onboarding site as well for you.
Support?
So in terms of, so if there were questions specifically in regards to the support of filling out those files. So there are two areas that you can contact for support. And I'll get you the phone number and the email for both of those. The first is the SURF Issuer Support Help Desk. And they can't help you answer questions in regards to what type of data you should be putting in or how to interpret certain fields. They can help you with validation issues, things that aren't linking up, kind of more of the technical discussions in regards to the files. There is also the CMS, they call it XOSC, which is the Exchange Operations Support Center, and they are there to assist issuers with more of those kind of policy questions, of how you should be filling out, what type of data you should be putting there. Give me just a moment, I'm going to get the phone numbers for those and the email addresses for those. The information that I'm referencing was published in the SURF Plan Management Forum presentation. So it's also a resource that is published on the SURF website. The CMS help desk via phone, the phone number is 855-CMS-1515. Once again, that's 855-CMS-1515. And the email is CMS_FEPS. That's CMS_ F is in federal, E is in exchange, P is in policy, S is in support, at cms.hhs.gov. And that's for any questions regarding to filling in the QHP information. For the SURF support, let me get you their contact information here.
And we'll post it on our website.
We'll post a link to the presentation on the website as well. Hang on here.
You can also send that information out on a Carrier email so everyone has it.
Yeah. Okay. The SURF Help Desk is area code 816-783-8990. Once again, that's 816-783-8990. And the email address is surfhelp, that's SERFF, and then help, at NAIC.org. And both of those resources are there to help issuers in completing those templates and getting those submitted prior to the June 7th deadline.
Yeah, we really want to stress the importance of getting that binder started and submitting templates because of that June 7th, and there is quite a bit of work there. So if you haven't started, we highly recommend you start this week.
In the presentation, we talked about a requirement to notice if there is a modification, and that's in the Public Health Services Act, Section 2715 D4, and it's codified in IRS 26 CFR 54.9815-2715, paragraph B. We will provide that updated. It's this long. You probably mistranscribe it when I read it again. So we'll update the presentation with the correct item. But it says notice of modification. If a group health plan or health insurance issuer offering group health insurance coverage makes any material modification as defined under Section 102 of ERISA in any of the terms of the plan of coverage that would affect the content of the SBC that is not reflected in the most recently provided SBC, and that occurs other than in connection with the renewal or reissuance of coverage, the plan or issuer must provide notice of the modification to enrollees not later than 60 days prior to the date on which the modification will become effective. The notice of modification must be provided in a form that is consistent with paragraph A4 of this section. So there you go. We'll update the presentation with the appropriate citation.
All right. Well, thank you, everyone, for joining us on the phone and here in Carson City. And look forward to speaking with you next week to talk about public education. Thank you, everyone.
Thank you.
Thank you. Thanks, guys.
Thanks.
Thanks for sitting in the front row.
Yeah.
Well, I wanted to be in reach.
Okay. Hi, how you doing? Poor Red Sox, they have such a tough time. I know.
Oh, really? That was the one.
John's done.
Oh,
sorry.
Oh, that's good.